Hello, this is Dr. Hany Abu-Farsakh. I'm an orthopedic surgeon from Jordan. Today I'm going to perform the examination of the knees. Of course, I gained the consent from my friend Ashraf to publish this video for the University of South Wales. The examination of the knee starts from the moment that the patient starts walking. Once he starts walking, I have to observe his gait in case there is an antalgic gait or signs of waddling gait, which might be in cases of geno valve. Of course, during the inspection of his gait, I also assess for signs of genovarus and genovalgum. ممكن نضم الرجلتين مع بعض. Okay, during this part of the examination, I can't see if there is any signs of genovarum. I usually try to squeeze my fingers inside and check if there is 2 or 3 or 4 fingers, which might indicate the severity of the genovarum as part of the inspection examination for the knees. Once I conclude the inspection of the gait, I also assess for signs of pes planus or flat foot. ممكن تبعد رجليك التنتين عن بعض توقف على رؤوس الأصابع, and by that I can assess if there is any signs of flexible flat foot or rigid flat foot. ممكن تنزل. Okay, ممكن تتمدد. Now we progress with the examination by inspection over while he's lying down on bed. During this part, we can look for any signs of abnormalities or asymmetries between the both knees. If there is signs of fusion or masses around the knee, if there is previous scars or signs of previous surgery around the knee, if there is any signs of abnormal patellar position, for example, patella pagina or infera, that can be assessed during this part while he's in extension, as well as while he's doing flexion. And of course, I also would like to assess if there is any signs of limb length discrepancy, and usually I use the examination of limb length discrepancy by doing the Gilead's test. Once that's concluded, I can progress to the assessment of the area around the knees by inspecting for any signs of muscle wasting. Of course, measurement of these areas circumferentially can be performed, but I will not do that due to the shortage of the time. The muscle tone can be also assessed, or the strength of the muscles can be assessed by doing full extension, which is helpful to assess the extensor mechanism, which combines the quadriceps and the patella and the patellar tendon. ممكن ترفع رجلك لفوق بشكل مستقيم. Okay, and I try to resist it and just to assess the muscle tone and the muscle strength around, and if there is any signs of wasting around it. And we do that over the other side. Part of the examination is the range of motion, where I try to check if there is full extension. I try to put my hand behind. If there is, for example, an extension that you will have a space between your hand and the couch while you are inserting your hand behind the knee. If that's full extension, it will be resting over my hand from the dorsal side. And also we assess for deflection, and we can see that there is full flexion over the knee. That's the range of motion examination, which is part of the inspection. Once that's concluded, I can progress to the palpation of the area, where I start by palpating the patella and its position, and I try to feel the medial facet, the lateral facet, and I try to squeeze the patella inside just to check if there is any tenderness or pain that might be related to patellofemoral pathology. Once that's finished, I try to palpate over the muscles and try to check if there is any signs of asymmetry or wasting of the muscles. As the palpation of the patella completed, I start to palpate the patellar tendon and the tibial tuberosity while it's in extension and while it's in flexion, and try to check if there is any signs of peripatellar soft tissue lesions or masses or just pain, something like the bursa. Part of my palpation is the palpation of the medial joint line, the lateral joint line, the quadriceps tendon, and the fibular head for signs of instability or tenderness around the ligaments of the patella, of the fibular head. Now, once that's done, we can progress to assessment of the medial and lateral menisci with the special test of McMurray. Usually I do McMurray by resting the foot over my palm of the hand, and I try to squeeze the medial meniscus inside, and I do full extension, and also for the lateral meniscus with my thumb, trying to press inside. While I'm doing this movement, I try to check for clicking or signs of any movement of the menisci, and I also ask the patient if there is any pain. Okay. So that's how I examine for the medial and lateral menisci. As we are going through the examination of the ligaments, I start with examining of the anterior cruciate ligament and posterior cruciate ligament, and this can be done with the anterior drawer test, which can be performed while I'm sitting on the foot, or just I'm holding the foot and trying to check for anterior translation of the tibia under the femur. Once that's done, we can do also Lehman test, which is at 30 degrees of flexion, and I try to translate the tibia under the femur as well. Pivot shift test, I'm not usually doing it in the clinic. Usually I can do it and assess it in the theater if I'm planning to do an ACL surgery. Now, the assessment of the medial collateral ligament and lateral collateral ligament can be performed on extension and on minimal flexion, such as 30 degrees of flexion, just to assess if there is any looseness of the medial collateral and lateral collateral ligaments. Now, as part of the examination of the knees as well, we can do the patellar tab as a special test, or part of the palpation test, just to examine for signs of fusion by milking over the suprapatellar pouch and try to push the patella down and check if there is any signs of tab. Once that's concluded, I prefer to do the dial test to assess for posterior lateral corner injuries in addition to the ACL injuries. It's not the something that I do if there is no ACL or suspected ACL injury, but if we are suspecting an ACL injury, I do the DL test, and we usually do it while he's lying down on his abdomen. So I will do the DL test now. Can be done 30 degrees and try to assess for any asymmetry between both lower limbs, and at 90 degrees and trying to assess that as well. In the prone position, we can also perform the Ackley test, which is used to assess for the medial and lateral meniscus injuries, where we can do external and internal rotation to assess for these kind of injuries. So that's also can be used to assess for the meniscal injuries. Now that's concluded, we can go on Ta'ala Ashraf and do the examination while he's standing to assess for the patellar pain in case of squatting. ممكن نتلفظ and we see if there is any signs of pain while squatting. Stand up, okay. And we can do single leg squatting, رجل واحدة, ننزل ونطلع, okay. And we can do the single hoop test. ممكن تنط على رجلك. Yeah. And by that we are able to conclude the examination of the knees by doing the single hoop test. Thank you very much.